All right, so without further ado, we're going to jump into our program, and it is my great pleasure to welcome Jason Mendelsohn, also known as Superman HPV, as our keynote speaker. Like many of you, Jason is a survivor of HPV-associated tonsil cancer, and since his diagnosis, he has really worked tirelessly to get the word out about the relationship between HPV and certain head and neck cancers. He and his family regularly participate in a number of different outreach events to inform the public about the importance of the HPV vaccine. He serves as an ambassador and a member of the executive board of the Head and Neck Cancer Alliance, and his energy and dedication to advocacy for head and neck cancer causes are infectious. And he is the perfect person, I think, to kick off our day today. So welcome, Jason. Thank you so much for joining us today.
When I was preparing to speak with you all today, I always get nervous. I will tell you, I have 30 minutes right now. It's going to be like a roller coaster ride for you probably. But I try to think of all that's transpired over the last 11 years, which led to me flying across the country to speak at Stanford, a school that my SAT score would be 600 points too low to get into. And it's truly humbling that Heather and the planning committee asked me to speak today. It's an honor, and I really hope that you find something in it whenever I prepare. And normally I'm speaking to a lot of medical professionals, not when there's a majority of survivors, patients, caregivers. So things were a little flipped in my head when I'm presenting today, but I'm hoping that you get something out of it. You find it interesting, informative, and at least my talk touches at least one person, and then it makes a difference. So again, thank you for having me here today. If you ever wonder if you have to be perfect to present, the answer is 100% no. I am carrying with me my cell phone that I dropped in the toilet this morning at my hotel while I was speaking with Delta, moving my flight to this evening. And so I was able to call my wife and family and tell them that I would not be on my cell phone all day today. Soaking in a thing of rice. So anyway, that was just something so you can know you can be real and do this. As well, I do cry, just to be honest with you. You're going to see that I get pretty emotional. It's very difficult for me, but I think the importance of sharing my story is more important than the uncomfortable feeling I get sometimes when sharing it, because I've been able to impact people worldwide. Hopefully you don't think I'm an arrogant jerk when I present today. When we go with Superman HPV, I'll explain that to you briefly. So my friends called me Superman during chemo and radiation. And so I decided to adopt the name Superman HPV to draw attention to a diagnosis that I truly never heard of. And I think that's really the important part, is it's not that I think I'm Superman, but that they thought I was tough like him. And so I adopted the name, went public, and got a lot of attention, because I will tell you 11 years ago when I got this diagnosis, the only person that I could find online that had this diagnosis was Michael Douglas. And so I don't have it in my slides today. I only have a handful of slides, but the number one question I got asked for probably 5 years was, is this what Michael Douglas had? And my answer is always, it's the one thing he and I have in common outside of our love for Catherine Zeta-Jones. And that was kind of it. And that went on for years, but it's not my slides today. I took some notes to make sure that I don't get too emotional and leave out things that I think would be impactful to you. So again, if you're comfortable with this, by a show of hands, survivors in the room, patients, caregivers, medical practitioners. That's helpful to me, so when sharing my information, I just know what will be the most relevant. And I will say that as a survivor, my wife was a tremendous caregiver. I want to add that to you, add that for you. She had a large responsibility. What was that? That was to take care of me and be as positive as possible while maintaining my kids' lives so they didn't worry that their father was passing away in the bedroom. And I will tell you, it's very hard to be a caregiver. So I don't normally start with this, but I was thinking about this morning. I'm very, very, very sincere when I say this to you, that I think the caregiver job is the hardest. And so that's a shout out to my wife in case she's online watching, but also to the other caregivers in the room because I know it's very difficult. Let me look at here. I'm going to clear my throat a lot. You know, I probably don't have to explain this to you in the room, but I always have to explain to everybody else that I don't have COVID, right? I'm not sick. I always have to explain on flights or wherever I am. I'm like, throat cancer survivor. It's just what we do. I have water up here that I will drink, but I'm perfectly healthy just for that purpose. Let me move to, that's my contact, by the way, and don't be hesitant to contact me. That is my phone number. I've been giving it out for 10 years, and it's never been abused. And so I literally just text me, call me, whatever I can do to ever help people is what I do. They always ask for disclosures. I always say I have nothing to disclose other than I serve on the board of the Head Neck Cancer Alliance as well as for the HPV Cancers Alliance. A shout out to Heather again and the Head Neck Cancer Alliance, because while I wasn't famous years ago when they wanted actors and actresses, they embraced me, and I will tell you it is the kindest organization with tremendous information. And so if you ever need anything, please call me or speak with the Head Neck Cancer Alliance outside of what you're already doing here with Stanford. That is our mission, to provide hope and support to individuals impacted by head and neck cancer, to raise awareness about prevention and early detection, and to advocate for improved patient outcomes. So let's start with my family. I will tell you everything I do is about my family. I am wearing them in the inside of my jacket, if anyone can see this. That is my wife and kids. They're on my pocket square. I know it's a little obnoxious, a little crazy, but it's everything. They're everything to me. So like I mentioned, to date, doing this backwards, but I've been married 28 years to my wife, Ronnie. I've known her since I was a little kid. Our boy-girl twins are 23, and our twins are my daughter and my son that is next to my wife. Those are the twins. She's like 5. I know she's watching, Lauren. She's like 5'7". She's 5'3". And then her twin brothers are on 6'1". And then my son, the youngest, who is 17 with all the hair, that was my hair at my bar mitzvah, in case you're wondering, is there, and then my wife. And anyway, everything I do is for my family. And so when I'm with practitioners, medical practitioners, I always say, the work you do is so important. It protects families like mine. Here it goes. It protects families like mine. And so I think if you're in the room and you're a medical practitioner, I know there were a lot of people over there in that area, doing what you do every day literally protects families like mine from dealing with cancer. And I think it's really, really important. And so I commend you and thank you on behalf of all the families you haven't yet touched or those you have. Really important. That other picture, believe it or not, and I'm going backwards, telling you it's too confusing, but so after I beat cancer, I launched a website called Superman HPV to provide inspiration and information for those diagnosed and or researching HPV, the HPV vaccine, and HPV-related cancers. And I thought, this has got to help someone. And I hope it does, because when I searched the internet in 2014, all I saw was people with their teeth falling out, jaws cracking, no saliva. It was so depressing to me, I could barely handle it. And so I swore that if I survived, I would launch something that would help others. And that's where I launched that website. Move it forward a few months. I'm getting out of my car at the airport in Orlando, which I live in Orlando, in case you're wondering. And my phone rang, and it was a health reporter for NBC Nightly News. And they're like, "Are you Jason Mendelsohn?" I'm like, "I am." They said, "We would like to feature your family. We're doing this show about the epidemic among men regarding the HPV, virus, head and neck cancer." And I'm like, "Okay, great. I will be home on Tuesday. I'm very excited." They're like, "We found you in an article, this whole thing." And they're like, no, you don't understand. We've already set a TV crew to your house. They will be there in 3 hours. If you want to be on NBC Nightly News, you need to go home. Let me explain to you. I'm president of our family business. We travel all the time. We work. And I called my wife, if I was ever, Ronnie, if you're watching this, I love you, but if we were ever going to get divorced, it would have been that moment. my wife said to me, and she was quick, and she said, I need to get my hair done, my nails done, the house cleaned. Like, she got it all done. And then NBC Nightly News showed up, we did the interview, and then that night I flew out to go to my business meeting. But that picture has appeared in many places of our family. And that was back when my twins were 12, and my son was 6. And it's my dog, Des, by the way. Let me tell you a little bit more about me. So my life before cancer. When people speak, I don't know if you feel this way, but I always wonder, like, I want to know more about them, how they got to where they are. And so back in 2014, I was president of our family business. This is not going to be very sexy to you. We appraise life insurance for a living, sell it to pension funds. That's our family business. Nothing to do with cancer. But I was traveling 2 to 3 times a month all over the country, working 50 to 70 hours a week. My brother is CEO of our company. My sister is EVP. Our dad's on the board, 25 people. We worked all the time. I did not have time for what was going to come. I will also describe my family to you, and hopefully people in the room know this, but do you know the Waltons from years ago? John Boy, the Waltons. Good night, John Boy. That family, and do you know my big fat Greek wedding? So if you meld those two families together and sprinkle Judaism on top, that's us, right? My brother is my next door neighbor. My parents and sisters live 5 minutes from me, and we are just like those families I just described, and we are always together. And so on weekends, my twins were 12, we were going to, competitive basketball games, 2 different cities. My wife and I were in 2 different cities with our twins. We were going on date night once a week, and we were busy. And then I was taking a financial exam for my industry, for the family business, and I put my hand on my face to ponder a question, moved it down to my neck, and I felt a bump. That bump appeared out of nowhere, so let me tell you that I had hair and no beard back then. I shaved my head and grew a beard during COVID because I wondered what it would look like. It makes me feel a little more tough, so I kept it. But I felt a bump. I said, I don't have time to think about dying. And I literally, at the time, I remember thinking, it sounds like I'm a hypochondriac, but I don't have time to think about dying right now. I need to pass this test, which I did. I went and saw my dad, who's a doctor, a dermatologist, and I said, what is this? He said, let's call the ENT, which again, I will tell you, for those of you in the room and those of you listening, I can't tell you how many times I speak with people, and it took them 2 years to get to an ENT. So it's really important that if you have a bump that appears on your neck out of nowhere, sore in your mouth that's not healing, a fishbone feeling in your throat, something like that, go to your ENT, your ear, nose, and throat doctor. So I called my ENT, and he was like, you don't smoke, you don't drink heavily, come see me in a few weeks. And I'm like, okay, great. I'll be there on Monday. Because I'm a guy that goes to the doctor. I'll tell you that's really important. I go to the doctor. I'm not a guy that's too manly, which you've probably figured out by now, to go to the doctor. So I go. I went to the doctor. They looked at my neck. They said, let's put you on 10 days of antibiotics and steroids. In the slight chance that it doesn't go away, we'll immediately schedule you for a needle biopsy and CAT scan. Fair enough. Started the antibiotics on Monday. Flew to the Keys on Wednesday. Ran the equivalent of a 5K. Partied with friends all weekend. I was the healthiest I've been in years. I had lost a bunch of weight. I was feeling great. Sunday, left Capitol Hill, flew to Capitol Hill on Sunday, lobbied on Capitol Hill there. Wednesday, flew home. Thursday, CAT scan. Friday, needle biopsy. Monday, stage 4, HPV-related tonsil cancer. So I will share this with you. Are we being recorded? Okay, well, I'm going to share this with you anyway, because I figure you're Stanford and I got treated in Florida. So I'm a guy, if you can't tell, I'm fairly aggressive, and I called after I had my needle biopsy and CAT scan, I called the doctors all weekend. I was calling the hospital, are the results back yet? Are the results back yet? Because I knew I didn't have any problems. And on Monday morning, they said, oh, they just came back. I said, great, can you fax them to my doctor? They go, we'd love to. Thanks for calling us all weekend. We know you're excited to get the results. I said, yes, here's his fax number. And I gave them my e-fax. Because my summer job was taking pathology specimens to the dermatologist for my father, so I can read a path report, and I knew I wasn't gonna have cancer, so it didn't matter. And so they faxed it. I'm standing in my living room. I open the path report on my phone, and it says, I don't even, it's so hard for me to say it, but it basically said I had cancer. The short story is, I was going to read the whole thing. And I saw it and I'm like, I cannot believe I have cancer. Now, this is meant to be a little humorous when I say this to you, but I'm the oldest of 4 kids. Everyone knows parents love their oldest kid the most. The fact that I have to go call my parents now and tell them I have cancer was literally very difficult for me. My siblings are watching out there. You know it's true. I sent the email to my father, who was in a patient room. He's a dermatologist, like I told you, 50 years in Orlando, and he stepped out of his room and he goes, "Hey, I see you're calling me. Is everything okay?" I said, "I need you to look in your email." He goes, "What's going on?" I go, "I think I have cancer." Which, let me tell you something, that was something other people had, not me, right? Like cancer was elsewhere, not in my house. And he opens, he was standing in like a room or the hallway, and he looked at it, and he said to me over the phone, I'll never forget it like it was yesterday, he goes, "It looks that way." And I'm like, I don't even know what to say. So then I had to go to my ENT, pretend like I didn't know that I had cancer because I wasn't supposed to have the path report. They told me I had cancer. I'm like, oh no, what do we do? And then he says, you're going to need a radical tonsillectomy, neck dissection, which I had both. So, I had radical tonsillectomy, neck dissection, so I have 42 lymph nodes removed from my neck. I have a scar that runs from the bottom of my right ear to the center of my throat. I see it every morning. And he goes, you're going to need radiation. I'm like, okay. I go, what's my chance of survival? And he said, it's 85%. I'm like, okay. What about chemo? He goes, well, that would add another 7%. I'm like, okay, 92. I'll have that too. He goes, do you want to think about it? I go, no. If my kids had a choice to get an 85 on a math test or a 92, I would choose a 92 every day of the week. So I'll take both. And so we started the process. On the way home, am I okay time-wise? Yes. On the way home, I called my friend who is a radiation oncologist, and I said, it looks like I'm becoming your patient. He said, what are you talking about? I just saw you at a party a week ago. I said, I just got diagnosed with cancer. I called my 2 life insurance agents, and I said, please make sure my policies are on automatic draft. They go, what are you talking about? I go, I just got diagnosed with cancer, and I need to make sure that if I get really sick, and God forbid things go south, that my wife and kids are taken care of. That's how it began. And I will tell you that I asked for a feeding tube because I said to my doctor, what's the worst thing that could possibly happen that gets me, sick? Like, how do I end up somewhere? They go, most people or a lot of people get dehydrated. This is, again, remember, 2014, not today. I said, okay, well, how do I stop from being dehydrated? They said, get a feeding tube. I said, great, I'll take that too. So I got a feeding tube. 7 weeks, like I said, chemo radiation feeding tube. Took 5 Ensures a day, right? 2 Gatorades a day through that feeding tube, all my medicine. I didn't like it, but I liked living. I was in bed 18 hours a day for a month. I tell people the only great thing about that was that I got to watch 7 years of Lost in 2.5 weeks. It was a horrible ending, by the way. Don't watch Lost, in my opinion. I was gagging and choking 40 to 60 times a day. My saliva got so thick that I couldn't swallow it. I was spit into a large Slurpee cup. The first time I did that and poured it into my sink in my bathroom, it wouldn't go down the drain. It was that thick. It was just brutal, and I know those of you in the room that have been through it. I was in bed, literally, I was so tired I had to sit in the shower, and I was so tired I couldn't walk steps. And again, I tell you all that because if you're going through treatment now, and I've dealt with people going through treatment, just so we're clear, that never missed a day of work, and people that had it worse than me. So I want you, if you're in the room, you're listening, I'm sharing my story. Yours might be the piece of cake that this guy that I dealt with had. Literally did not miss a day of work and went through my same treatment. And then there's the other side that people are worse. But this is just my story. So don't be nervous. I always get hesitant to share it in a group like this because I don't want people to think this has to happen to them. It does not. So remember that, please. So I began radiation. Those are pictures of me going through it. And honestly, I coincidentally wore a Superman shirt. People started calling me Superman. That's kind of what happened. But I did not like radiation. It was brutal, and I didn't know what to expect. Like when you know other cancers, you get worried about chemo, right? Everyone gets so sick from chemo, you think that is the worst of the worst. And then you deal with head and neck, you're like, that is not true. Chemo was like a cakewalk. as far as I was concerned. I ended up taking not only compazine and Phenergan, but I also took Amend, which was another drug I took to not be nauseous, but I felt seasick 24/7. So I'm a few weeks into treatment, and I'm thinking this is not so bad. But I was nervous because I didn't see anyone on the other side like that I had known. So I made videos. I made videos to my 3 kids saying goodbye, and the videos went something like this. One day you're going to get married. I'm not going to be there. This is what's important. And I made those videos over and over and over again, knowing that if they were the last things that my family ever heard from me, that I wanted them to be perfect. And I sat in my living room for hours making these videos because I couldn't get through them. It's the one thing people always want to see a copy of, and I deleted them after I survived because I never wanted to see them again. But that being said, I survived. So it was, again, you're in a different place 11 years later because you see people who are surviving everywhere. I literally didn't know anyone that had this diagnosis, nor never heard of it. I would call people, they're like, I don't know what that is. So my daughter is watching today, and I'm not including this because she's watching. I always include it, but this was a poem she wrote about me while she was in school for a project, and it says, "My hero, my dad, he is Superman. He is always strong. He is always determined. He is always sweet. He is always loving. He is always funny. He is a survivor." I will tell you that it means the world to me. I talked to my wife, took my phone out of the bag of rice, called my wife, and she says, "You're going to do great." And she's not involved in this advocacy work because it hurts her to go through this experience over and over and over again. For her, it's not her thing. But she fully supports me doing this, and she's always been supportive. She's been terrific. And my 3 kids as well have been very supportive. My daughter went with me to a conference in Edinburgh, Scotland, where I spoke through IPVS, which is the International Papillomavirus Society meeting, which will be in Bangkok this coming October. And then my sons made videos, and one of those videos has reached over 1.9 million people as part of the One Less Worry campaign through IPVS. If you don't know what that is, we can talk more later. I have 10 minutes, correct? 10 minutes. Let me look at my notes real quick to make sure I don't leave anything out that's really important. So this is some of my advocacy work. I've spoken and been fortunate. That's me with hair. I don't actually have to show you that, but that's me. And I spoke at a part of congressional briefings to increase HPV vaccination rates. It was always funny because at this congressional briefing where I spoke, the doctors had their titles on their placards, and mine said Superman HPV. It's funny to me. But I share my story often because you never know who it's going to impact. And the Prevent HPV Cancers Act is something that we're trying to get to go through so we can educate people at a larger scale nationally. So we're looking for bipartisan support. So I'm active on that side. I'm going to just share some things with you. And my advocacy started out, for those of you in the room who are just brand new to advocacy, I told you I work 50 to 70 hours a week in our family business, which is all true. I would spend 30 minutes a day calling newspapers, calling just public health areas, saying, "My name is Jason Mendelsohn. I'm a survivor of HPV-related tonsil cancer. Have you ever thought about doing an article? Do you ever think about talking about the HPV vaccine?" And after a while, I called the Miami Herald 3 months in a row, almost every day, and they ended up putting my story in Spanish in El Nuevo Herald, as well as in the Miami Herald. It's been shared in Jewish papers all over the country because my local paper that even wrote about me for my bar mitzvah, called The Heritage in Orlando, put it in a national thing, and I ended up in like Jewish papers all over the country. I called Canada, and Canada put me in the Canadian Jewish News. And at the end of the day, other places, NBC Nightly News, and other places started picking it up. So I will tell you, if you're starting in advocacy, it starts just grassroots, dealing with someone local, dealing with your dentist, dealing with your family practice, pediatrician, whoever. But that's where it starts. I just have been doing it a lot longer, so I have a lot more exposure. So I'll just tell you, it can start wherever it starts, and it can go as big as you want it to go. These other pictures, I hold a Raise Your Raise Your Glass event, which is me holding the microphone, where we wrap a Mercedes-Benz with the names of cancer patients, survivors, and caregivers of any cancer type. We raised 45 grand the first time, 105 grand the second year. And we have sponsors, and it's meant a lot. People can honor the people they love who are still living or have passed away. The picture in the middle and the bottom, I did the Ride to Conquer Cancer when I was finishing treatment. One of my clients out of DC sent me a video, and I was in bed 18 hours a day for a month. And the video had a picture of one of them making a video with my name written on their cycling shirt as one of the people they were riding for. And when they finished their ride, they said, Jason, when you finish cancer treatment, we'd like you to ride with us next year. Well, I had never been on a road bike, never clipped in, owned nothing. And that May, so I finished treatment August 11, 2014. That May, I started training. A woman from a local bike store came to my house every day at 5 a.m. And it's very nice. I get choked up about this too, sorry. And I trained 5 days a week. So it is what you do also when no one's watching that matters. I trained and I trained and I trained. I ended up raising 30 grand online and was one of the opening speakers at the Ride to Conquer Cancer in DC that following year. Rode 130 miles in 2 days. But again, that was for awareness, shared my story there. And then to the right, I had been flown to Dublin, Ireland to share my story to a group of 50 doctors from all over the world. And I did that. And little by little, and the reason I tell you that is it's not a me. I hope this doesn't sound obnoxious at this point. What I'm trying to say is that, does it sound obnoxious? No. It can start out with like your little local paper and go to, I've shared my story now in Edinburgh, Scotland, and Dublin. I'm probably going to Bangkok in October. And it can be as big, and no matter how busy you are, I still work 50 to 70 hours a week. But I discussed this morning, did I say this already about I said I dropped my phone in the toilet, but did I already tell you that I had to call the front desk, ask for a bag of rice? I got there and there's 4 people, two guys, 2 women. And I go, thank you so much for the rice. I'm here in town. I go, have you all ever heard of the HPV vaccine? None of them. And I said, here's my story. I'll give it to you for 2 minutes. And after I shared my story, they said to me, I didn't know that. I didn't know that 3 out of 4 adults by 30 had the virus. I didn't know that in the last 48 months, tongue, throat, and tonsil cancer has surpassed cervical cancer and become an epidemic among men that also impacts women. I didn't know everything you just shared. And I never heard of all the cancers that it protects. So most of you know cervical cancer. Obviously, you know head and neck cancer. But there's vaginal cancer, vulvar cancer, penile cancer, oropharyngeal cancer, right? There's all these different cancers. I'm learning about RRP, recurrent respiratory papillomatosis, when a baby can be born and they can get HPV in their lungs. And that vaccine protects against all of this. And so I shared my story, so I think, I'm not as religious maybe as I could be, but I do think that maybe God has a plan. So maybe I dropped my phone in the toilet while speaking to the Delta woman, so I would end up at the front desk to educate these 4 people, because all 4 of them asked for my cards. I have little Superman cards that say, just, it's all temporary. So I thought maybe that happened for a reason. And honestly, this is remarkable that I'm on this time. Let me share this with you, and to me this is very exciting. One of my close friends, who is a colleague of Heather's here, not here, but at UCF in Orlando, they know each other, is working with me on this project. So my goal is to have my cancer story shared in as many languages as possible in all 7 continents to save lives worldwide. That's my thing. I say it all the time, and I truly mean it. And I deal with people all over the world now. I've dealt with people in Sydney. I've dealt with people all over the Middle East. I've dealt with people in Canada. I deal with people, probably 2 to 4 cancer patients a week, survivors, patients, caregivers from anywhere in the world that find me on my Superman HPV Facebook page. Typically, if you look at my Instagram, by the way, I know it looks pathetic. My mom, unfortunately, got diagnosed with ovarian cancer 9 months ago. Our family's been very focused on taking care of her, obviously, as we should be. And I wasn't watching my email or my Instagram, and someone hacked my Superman HPV Instagram and deleted 8 years of cancer advocacy work. And so it looks very sparse. I will tell you, if you have any social media, I would use dual factor authentication, just to tell you, even if it's social media. So now my stuff is all protected. But anyway, this is something that is really important to me. I'm very excited by it, and hopefully I do this right in showing you it. I am 51 years old. I am a survivor of stage 4 HPV-related tonsil cancer. I'm sharing my story because I really want people to understand the importance of the HPV vaccine. 51 год. Я, например, выживший после рака миндалин 4-й стадии, связанного с ВПЧ. Я делюсь своей историей, потому что действительно очень хочу, чтобы люди поняли действительно важность вакцины против ВПЧ. 51岁，我是四期人乳头瘤病毒相关便套体验的幸存者。我分享我的故事，是因为我真的希望人们能理解人乳头瘤病毒疫苗的重要性。So that's very exciting to me, because if you would have said to me 11 years ago, we're going to be able to leverage your cancer story to be able to save lives worldwide, I would have thought you were crazy. And now over 11 years, I've seen what's possible. Better? Thank you. Someone just, good. Okay, sorry. And I only have a minute left, right? Or am I over? Ooh, I am over. All I was going to tell you is this. Very excited about where this is headed. Anybody in the room, no matter where you are, where you're headed, can do the same thing or something similar or something bigger or smaller. Everyone has their own story to share, and different people impact different people. And I'm really honored that I am, that's where I want to be. I'm really honored that I was asked to speak today, and I'm humbled as well because I know many of you in the room are survivors just like me, or patients that I've been through what you're going through, and caregivers. And I just want to let you know that I hope something I shared today created impact in your life, and that it helps you either get through treatment, feel stronger as a survivor, or help others get through what they might. You never know who's going to experience this in the future. And so I hope something I shared today impacted you. I appreciate you having me speak. And I will be here all day. If anyone wants to chat, I'll be here till the end. So thank you again, and I appreciate, again, every one of you for paying attention to my story today. Thank you.